HIV-AIDS, because HIV-AIDS is still a big deal. In this program, we're going to take a no-hype, no-fear, and factual look at HIV-AIDS. What is it? How do people contract the virus? And what steps need to be taken to prevent infection? We'll also hear from medical experts and several people who are living with the HIV-AIDS virus. HIV stands for Human Immunodeficiency Virus, and AIDS is an acronym for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV disease, which causes severe damage to the immune system. Today, many people have the impression and an attitude that HIV is nothing more than a disease that doesn't really affect them. They think it's a disease they shouldn't be concerned with because there are pills that can help treat the disease. Ask yourself, are you concerned about contracting HIV-AIDS?
So people think that getting HIV-AIDS is not a big deal anymore. They are so wrong. This is not a disease that anybody wants to mess with.
Well, over the last 4 decades, since the first HIV cases, AIDS cases, were reported in 1981, one of the biggest ways that the public perception has changed, one of the biggest reasons the perception has changed, is because starting in 1996, we finally had effective treatment for HIV infection, so that no longer was HIV infection necessarily a fatal illness. So in the years before that, when HIV infection really was tantamount to, a death sentence, you could be pretty certain that if you were diagnosed HIV positive, that at some point you were going to get sick and die.
Well, it's a pretty long story how I contracted HIV. First, it had to do with drugs. My father was a big-time drug dealer in New York, from what I was told, and my mom became pregnant. She didn't know she had HIV. And then I was born with it.
I know exactly when I contracted the disease. Unfortunately, I was having unprotected sex, and that led me to become HIV positive.
Just 6 is when I found out that I had HIV, because I became real sick. I was going through a lot of surgeries, having a lot of ear infections, so they were like, what's going on? So they ended up just checking my mother, and my mother came out positive. And I was just the last one to be checked because my little sister was born, so they checked her first. And no, my 2 little sisters don't have it. I was the one that ended up with it.
Today, in the United States, HIV-AIDS is increasingly treated as a long-term, chronic illness. People who live with a chronic illness such as HIV-AIDS often face medical, personal, and social uncertainty.
That I was always getting sick and calling out, and they weren't understanding.
There are plenty of things that I would go back and change. I would have chosen to have safe sex every time, because it only takes one time. I would have not have slept with as many partners as I did. Would have definitely cut down on some of the drug usage that I had. I believe that all those things kind of led me down the path.
In the United States, over 1.1 million persons aged 13 years and older are living with HIV infection. Of that number, over 207,000 people are unaware